Good morning, everyone. I see everyone has their coffee. There's a lot of murmur when we started, and usually people are pretty asleep. We've got an exciting panel. I want to introduce them now. Our panel will hear from advocates and local leaders leading the charge on 988, representing the organizations on the front lines. First, I want to introduce Hannah Wesolowski, is the Chief Advocacy Officer at the National Alliance on Mental Illness. In the interest of transparency, please note that NAMI is the sponsor of today's program, but this panel is editorial in nature, and we felt it was important to include her voice on the panel. Adrienne Bridenstine is the Vice President of Policy and Communications for Baltimore's Behavioral Health System, and Laurel Stein is the Executive Vice President and Chief Policy Officer of the American Foundation for Suicide Prevention. Thank you for joining us. I first want to talk by remembering what number you called before 988, okay? Does anyone remember what it was? 911. Well, you could call 911, that's true. However, but the suicide, that's a good answer, actually, which is always good to call. But it was 1-800-273-8255. Now, to be fair, the last four is TALK. So it's 1-800-273-TALK. But in an emergency situation, who's going to remember that? I've been covering government since 1995. I honestly think this is one of the best things government's ever done. It's very simple, and it should have been done a long time ago. I want to go down the panel, and Hannah, start with you. And just describe, in a couple minutes, your group's mission and your personal connection to mental health.
Well, thank you for having me on the panel. So NAMI, for those of you who don't know, and hopefully most of you do, we are a nationwide alliance, the largest grassroots mental health organization, and we have over 650 affiliates across the country. Our mission is to provide support, awareness, education, and advocacy so that all people with mental illness can build better lives. We have families and peers as part of our network, and it's really about building a community that cares. And we've been really focused on 988 because for so long, people in crisis haven't gotten the help that they've needed. Instead, they are incarcerated, they are hospitalized, they cycle in and out of homelessness, or sometimes worse, they lose their lives. And we hear those stories every day at NAMI, so 988 is such an amazing opportunity for us. My family, as I'm sure most of you, is not unimpacted by mental illness. I have several close relatives who have mental health conditions, and it's so important that every single one of us has the resources we need when we need it. I have nieces and nephews who COVID was really formative for them, and they've been struggling. They've been struggling, and I want them to get the help that they need if they ever feel like they need it. So it's an honor to work on this issue and on this mission, and just delighted to be with my colleagues today.
Thank you. Good morning, everyone. I'm Adrienne Bridenstine. I'm with Behavioral Health System Baltimore. Behavioral Health System Baltimore is a nonprofit organization, and we serve as the local behavioral health authority for Baltimore City. So what that means is that we're responsible for overseeing that full system of care for mental health and substance use services. We do not do direct service. We fund services, we monitor programs and oversee programs. For crisis services, we fund around $15 million in crisis services for the Central Maryland region annually. Part of our role is to promote access to that system of care, and that's where 988 is critical. We used to use the old 1-800 number. The now new 3-digit, easy-to-remember number is the number that we use to promote access to that broader system of care. For me, in terms of a personal connection, just like Hannah said, my family's not unimpacted by mental illness. I had an aunt who suffered from mental illness and substance use. But for me personally, one of the biggest drivers for me now is my 5-year-old son, 5.5. I'm sorry, he would correct me right now, 5.5. That's the future generation. He already knows what 988 is, by the way. He's a COVID child. He sat through so many conference calls. He already knows what it is. But they're our future, and they can take 988 and help to transform the system. I want him and his friends to know that this is where you can call if you can't talk to mom or dad, which I know is coming when he will eventually hold me in contempt and not like me anymore. But that's one of the things that for me personally is one of the biggest drivers.
Laurel?
Good afternoon. First of all, I want to thank the Hill and NAMI for bringing us all together today in person and virtually on this milestone occasion for the 1-year anniversary of 988. As Bob said, I'm Laurel Stein. I'm the Executive Vice President and Chief Policy Officer at the American Foundation for Suicide Prevention. We're the leading nonprofit organization dedicated to saving lives and bringing hope to those affected by suicide, including individuals who've experienced a loss. We carry out our mission through being the leading private funder of scientific research, as well as community programming, public education, and advocacy. And we do so through our chapters. We have chapters in every state, 74 nationwide, including DC and Puerto Rico. We're headquartered in New York. I head up the DC Public Policy Office. And we know that connecting individuals who are experiencing mental health, substance use, and a suicide crisis need to be connected to care and to services, and far too many have been left untreated. We know that upwards of 90% of individuals who died by suicide had a diagnosed mental health condition, often left untreated. And so we, through our networks and our community partners and all are here to amplify and to build out 988, not only as a number, but also for that continuum of crisis care. I have been a mental health advocate for quite a long time. I see so many friends here. I've worked in many different jobs. I don't want to get emotional, but my husband is struggling with serious thoughts of suicide following cancer treatment, and so we're dealing with that.
It's a very emotional moment, and everyone does know somebody, and some are very close to us. I'm sorry to hear that, and I hope he does well. I'm going to start. I do want to go down the line, and Laurel, I'll start with you just on the success of 988, but also what needs to be done from this point on. We're only 1 year in.
Yes, and we need to applaud ourselves, right? And applaud the administration, applaud SAMHSA, the president, and ourselves. We need to pat each other on the back, because in the year that 988 has transitioned, as Bob was saying, it had that long 10-digit number. Thankfully, it had talk on the end, so you can at least remember the talk, 273 talk. But 988 is now in parity with the 911 number that we all, most of us in the room, grew up learning and knowing to push that really quickly. We know that we've had unprecedented federal investments in 988. From fiscal year 22, the Lifeline was at about $102 million. And in fiscal year 23, went up to over $500 million. And that's not even including all the money that was included in the Bipartisan Safer Communities Act, the $150 million, money from the American Rescue Plan, et cetera. And yet we do know that we're just at the beginning. We're just at the beginning. And while we're on that path to progress, there's a lot more needs to be done, and we need to recognize that a mental health response, and I credit NAMI to this, deserves a mental health crisis deserves a mental health response. We know this, but there's so much more to be done, really, to transform our crisis system into one that is equitable, as Secretary Becerra said, so it's supportive, it's appropriate, and it's accessible to all individuals, no matter what age you are, where you live, and that's particularly relevant to individuals who have been historically marginalized, underserved, Black and brown communities, Alaska Native and American Indians, LGBTQ, as well as individuals with disabilities, who I think are often overlooked.
Adrian, what about you? As I understand, the Baltimore's behavioral health system takes in calls from 988. So can you tell us a little bit about that, as well as your assessment of 988?
Yeah, I mean, so what we do is we oversee that system of care, and we have a regional 988 helpline that serves the Central Maryland region. One of the things that we actually did is we did just regionalize our helpline. In Central Maryland, we used to have 3 independently operating 988 helplines. We brought them together all under one roof. And the reason for this is because we recognize we're going to be able to better serve the community that way. People cross these geographic boundaries, so why wouldn't we operate in a regional way? And it's helped us to maximize our workforce, which, as we all know, has been a challenge for not just the behavioral health field, but across the healthcare sector. We've also been able to improve the timeliness of our response. Our 988 helpline, the regional helpline, answers calls within 10 seconds. That's fantastic. We want to keep that up. We've been able to use some of these federal and state resources to staff up, to get ready for, when the launch happened a year ago, to staff up and get ready, but we've continued to hire call takers so that we can be as responsive as possible. Ultimately, though, we know we need to be responding to the community, and part of what we need to do ahead, and I think Laurel alluded to this, is continue with that culture change. We know for way too long our communities have been conditioned to call 911, as you mentioned earlier, for emergency response because we didn't remember that 1-800 number. We've got to work with community to help make that culture change so that they're not only aware that the 988 helpline is there, but that they trust it.
Yes.
And we have a lot of work to do ahead of that. One of the things that we did locally leading up to the launch of 988 a year ago is we did extensive community engagement and outreach to hear exactly from the community what they wanted from us in terms of how we talked about 988 and how they wanted it to operate and be responsive to their needs. One of the feedback that we got from someone in Howard County was that they thought this was amazing. 988 embodied a lot of hope for this person, de-escalation, trauma-informed care, but she wanted us to put it into action. Make her believe it, is what she said to us. And we have to deliver on that. We need to make sure that this is a resource people trust and can feel that they can rely upon. So we have a lot of work to do ahead of that, nationally and locally, but I think we've got some strong footing and we're moving in that direction.
Anna, your thoughts?
It's been so exciting to see how not just the administration, but states have stepped up to build out crisis services. I mean, answer rates are through the roof compared to what they were, with demand up a significant amount. I think, roughly 40% year-over-year increase between what was that 10-digit number and 988 now. But we know that it's not just a number that we need. We need these crisis services. We need to have a full continuum so everyone has not just someone to talk to, but someone to respond in a safe place to go. And we're seeing pockets of that across the country where these services are being built up. I think one of our challenges in awareness is until that's consistent across the country, it's going to be hard to tell people what to expect when they contact 988. For some people, the only in-person response that might be available might be police or EMS. It might not be a mobile crisis team made up of behavioral health responders. Everyone deserves a true mental health response, and I think that's the challenge that we have moving forward, is our work's not done. There's a lot more work that needs to happen in communities across the country. So no matter where you live, who you are, what community you come from, you have an expectation of what type of response you can receive. That being said, to see how much bipartisanship and collaboration across groups has happened, and collaboration from federal and state level is truly remarkable, and the speed. I mean, 3 years ago, 988 didn't exist. It was a thought on the horizon that we might have this 3-digit number. And here we are, just a few short years later, with this resource that more than 4 million people have contacted since July. I mean, that's incredible. But not that many people know about it. Fewer than 1 in 5 people know that this exists and that it's a resource for them. I think that's going to be the real challenge going forward, is making it ubiquitous. So, my 3-year-old, your 5-year-old, everyone in this room and everyone we know realizes that this is a resource for them.
I wanted to talk about awareness, and we are going to open this to questions. I know we have a lot of great stakeholders in the room. Got about 10 minutes left, so think about your questions, and we have staff with microphones. But you all talked about awareness. What works here? Is it an ad campaign? How do we? I think it's 13% of people know about 988. Obviously, in the beginning, and I do think it's remarkable because you had different agencies involved. I talked to the former FCC commissioner at a prior event on this. You had states involved in a polarizing environment that this came together so quickly. A lot of pieces of legislation take a decade plus to get done. But what works in getting people, in educating people on 988? Anyone?
Building trust, I would say. I mean, building trust and communicating clearly to people what they can expect. A lot of times, we won't act, this is universal, people won't do something because they're just afraid of it, or they're
Right.
afraid of the unknown, right? One of the things that we learned through our community engagement and market research that we did leading up to the launch of 988 is that people did not, the word crisis did not resonate with people. They did not want us to call it a crisis line. They didn't know what we meant. And really all they wanted was help. So, and we heard that across populations. We also even heard it from youth. We just finished wrapping up some youth market research. Nobody likes that word crisis. It actually is a bit of a turnoff. So for us, what we did locally, and it helped us as we were building off of past campaigns, is we call it a helpline. It is what you can call for any type of help. You don't have to be in distress. You could just have a bad day. And our helpline operators are here to help you, get you connected to resources, or just talk to you. And that has been particularly helpful for us in helping to raise awareness. And we use that throughout all of our awareness campaigns. We do digital marketing, we do, all kinds of marketing. And then the other thing that I think is particularly helpful is working directly with community. One of the things we're particularly proud of that we've done in Central Maryland is we've launched a 988 Ambassadors program. And we've got the team over here who helped us launch it. So if you want to talk to them, they can tell you more details. But what it is we're working directly with trusted leaders in community across Central Maryland. So that could be faith leaders, community association members, your PTA leader. And we worked with them and provide them with our 988 campaign resources, but help them understand how it works, have them have direct experience calling the line so that they can communicate within their networks. Because it's a snowball effect, and it's gonna take years for us to support that culture change that we need. It's gonna take us 10, 20 years to get people to realize I don't have to call 911 or go to the emergency department for care. I can call 988 and I can trust it and have a reliably and safe experience.
Yeah, I'm so glad that you mentioned trust and involving community partners. We know far too often historically marginalized and underserved populations were met with tragedy often and met with trauma when they called 911. And now that 988 is here, it should be an alternative to 911, but it should be an effective alternative, accessible, supportive. Really proud that we have bipartisan members in Congress. Give a shout out to Congressman Cardenas, who is leading the 988 task force, crisis task force. It's a new task force, I think enacted last year. We didn't have a 988 crisis task force before. Legislation that he had introduced last year, and hopefully soon this year, the 988 Implementation Act calls for a public awareness campaign targeted also with 988. But it takes each and one of us. SAMHSA is doing a lot of the work as well. There's shareables, there's lots of resources out there. AFSP, NAMI, others, many are doing this. It takes each one of us really to spread the word, but we also need to ensure that communities are part of the fabric of the development and build out of 988.
Yeah, one of the things we've really pushed is that there are advisory bodies in every state and ideally every community that represent the community. This needs to be a system that works for all of us. So, making sure everyone has a seat at the table, from law enforcement to mental health providers and crisis responders to advocates and families who are impacted by our system, and diverse representation as well. We can't pretend that our current system impacts everyone equally. Having a police response does have an equitable impact on individuals. And so making sure that folks are at the table to build these systems, not just 988, but the crisis services, is important. NAMI just released a poll, and we found that the vast majority of people believe that if you dial 988, you get an in-person response. And I think educating people about what to expect and how it's kind of like 911, but it's also very different. 80 to 90% plus of people who contact 988 are going to be de-escalated over the phone and ideally connected to local resources. So we're reducing the need for an in-person response altogether, and I think that education component is going to be important. But I completely agree. We need those trusted messengers. And one point that often gets lost is there has not been appropriations for an awareness campaign.
Yes.
So, we can't be surprised that awareness is low when we haven't really invested in that wide-scale research and promotion.
And we're not talking about billions of dollars here, right?
No.
No, I mean, I think anything at this point would be valuable, but you look
Right.
at a lot of, smoking cessation campaigns, we're looking at $50 to $100 million to save lives.
Right.
Like, save lives. I mean, it could have such an impact.
Let's open up for questions. If you have a question, please raise your hand. If you can identify yourself and keep the question to a short amount of time, like not like C-SPAN.
Thank you. My name is Rebecca. I am with Miller & Holt lobbying firm, and I currently go to George Washington University. My question is, I know that mental health affect college students. It affects their academic performance. So my question is, how are you working, and will you work with universities to help inform them and promote 988 in our college campuses? Thank you.
Yeah, I mean, I think that's a fantastic question. One thing we did find in our polling is that, young adults, 18 to 29, were more aware of 988 than others, but still far too low. I know NAMI has a campus program, other groups in the room have campus programs, and I think it's important for all of us to make sure that we're working with those groups to share this messaging. Again, a college student doesn't want to hear from me about 988. They don't have a shared experience with me. They want to hear from their peers. And it's really important that we, again, leverage those messengers to have that peer-to-peer communication. And it's going to be really important to spread that. And also work with campus, campus healthcare providers, and counselors and administrators to make sure they're aware of it. I think that's our challenge, both in K through 12 and in college, is we need to, the people who are in contact with the person in crisis need to also be aware of this. It's a resource for them, and it's also a resource that they can refer people to.
Yes. And just to chime in on that, we know that, it's the second leading cause of death, suicide for 10 to 34-year-olds. And the CDC, with their youth risk YRBS survey, youth risk survey, youth behavior survey risk, whatever, that 1 in 10 high school students even in 2021 were contemplating suicide. Actually 1 in 5 were contemplating suicide, and 1 in 10 actually attempted suicide 1 or more times. So we recognize that this is not only an overall crisis. We have suicide is the 11th leading cause of death, but particularly for youth and young adults who are in college. And just as Hannah was saying, there are many organizations, including AFSP and others, NAMI, who are involved in the community as well as in the college setting. So appreciate your question.
And if I can just note, one of the great things of the last year, there was a pilot that is now permanent for 988 for LGBTQ plus youth and young adults up to age 25 to have specialized resources. And we know suicide rates in the LGBTQ plus community far exceed the rest of the population. And so figuring out how we can make sure folks are aware of that specialized resource. So again, talking to peers, somebody with a shared experience, I think that can have an enormous impact.
And I'll just chime in, this seems like the great place to mention that you can also text and chat 988.
Yes.
You don't have to always call.
Yes.
One of the things that
That's a great point.
Yes, for when we're talking
My
about
kids don't
youth
pick up the
in
phone,
college,
so you
text and
gotta
chat. No, but one of the things, we just wrapped up some market research regionally, again, in Central Maryland for youth, and we found 2 really interesting things. One, validated what assumption we had, is that youth and young adults do prefer to text and chat to get in touch with 988 for help. So we need to make sure that infrastructure is there to be able to respond to them. We know we can answer calls in 10 seconds, but can we respond to texts and chats that quickly? We're not quite there yet. But the other interesting thing that we learned, which was a little rubbed against some of our assumptions, is that youth actually do want to speak to adults. They do want to know that they're getting in touch with 988 and speaking to an adult. They very often want to go to their colleagues and their peers for some things, but when they want some help and they're in distress, they had felt a lot of feelings of relief knowing that they were talking to a professional and that we're an adult on the line.
And that's especially important because of the mental toll that COVID took, and that's going to affect generations, right? I mean, my daughter didn't really have a prom or a graduation, and that's tough on kids. And that's what kind of challenge does that present going forward over the next decade or two?
We have to be mindful that even before COVID, the United States was experiencing unprecedented
Absolutely.
levels of crisis.
Yep.
And the mental health system was not meant for these challenges. We have numerous counties that have mental health shortage areas. So we have a provider workforce shortage as well. So moving forward, 988, as we've said, is not just a number, but it's that opportunity, this historic opportunity to really build out and transform the system that meets all the needs of individuals who are experiencing mental health and suicide and substance use crisis.
Time for another question, if there's one in the back.
Hi, my name is Andrea Wagner. I'm back here.
Yeah.
I'm the director for the California Association of Mental Health peer-run organizations. And, we've been talking a lot in our state about implementation of 988, but I'm also a mother of a teenager with mental health challenges and a sister to people with substance use and mental health diagnoses. And I was really excited about 988, I still am. I guess my question is, how can we build up the link between 988 and peer-run services and peer support? And how can we get more people that are answering the phone that have their own personal lived experience with mental health?
I think that's a fantastic question. Thank you for sharing a little bit of your own personal perspective. I completely agree that we need to lift up and elevate people with lived experience. They are what help to make the connection. We have a lot of call takers at our helpline that do have lived experience. So that's, I think, an asset to our helpline. One of the other shifts that we're also supporting across the system is with our mobile response team. So that's the team that will come out and respond in person. We're looking to hire peers and have peers be part of that team as well. So, and I think we can embed peers and people with lived experience across the entire system of care. It doesn't have to just be within the crisis continuum. But I also think we can look at what we might think of as non-traditional resources like peer respite. That's another asset that we can be looking at. And what that is a place for people to go. It's not a clinically driven model. It's a respite program that is run by peers. It is for where people can go and stay for up to 10 days, stabilize, and do it without that kind of clinical care that you might get at a crisis stabilization center, for example. So I think there are to answer your question, I think there's a lot we can be doing to make a stronger connection between the peer and lift up peers within our system of care.
As well as make sure that peer support providers are reimbursed and we have sustainable sources of funding for workforce.
Maybe one more. Who's ever closest to the mic? You pick, Casey.
Hi, my name is Filiz Oda-Basgeldia. I am the Executive Director of International Association for Human Values. First of all, I'm sorry about your husband. Are you considering breath-based tools and techniques to deal with mental health issues? I work for this organization. We offer something called the Sky Breath meditation. It's been researched by Yale, Harvard, among many other institutions, and found to be effective for veterans suffering from PTSD as well as students. And I know that it's almost mainstream nowadays to look at these kind of interventions, but I think the important thing is, will there be funding for it, serious funding? Because breath is something we carry with us. It has no side effects. It's free of charge. People can learn easily. And I wanted to find out if there's any studies on that one. And I just want to plug in. We are organizing an event, World Culture Festival. More than 100,000 people registered at the National Park, partly to create awareness about these tools and techniques. Thank you.
Yeah, I'm not aware of any research about it. It's not something I'm as familiar with as an intervention tool, but would love to learn more from you after.
Yes, I'm unable to answer your question, but I encourage you to reach out to AFSP, advocacy@afsp.org, and we can try to help you. Thank you.
We have run out of time. I want to thank our panelists, and also we have a short video from our sponsor, the National Alliance on Mental Illness, featuring the Mental Health Crisis Response Team. Please thank our panel.